Hi, I'm Kerri Weaver, and today we're going to be discussing congestive heart failure. At the end of this presentation, you will be able to discuss the causes of congestive heart failure, the signs and symptoms, and relate some nursing interventions that we can do to prevent any heart failure exacerbations. So some facts about heart failure and why it's so important. So about 5.7 million people in the United States have heart failure. 1 in 9 deaths in 2009 have heart failure as a contributing cause. And about half of the people who develop heart failure die within 5 years, so it has a really high comorbidity rate. And heart disease actually kills more people than cancer, stroke, and HIV. It can affect both adults and children. The signs and symptoms can be a little bit different. Today we're just going to be discussing adult heart failure. So what is heart failure? It's a disorder in which the heart can't pump enough blood to meet the body's needs. It's not that the heart is actually failing. That term is used a little loosely. It's that it's not working properly enough. So it's either a problem with it not filling enough or pumping, or it could be both. And in this diagram, it's diastolic and systolic. Those are types of heart failure that we'll discuss in the next slides. But diastolic, you can see that the chambers here in the left atrium and ventricle are becoming stiff, and the heart isn't able to fill because it can't contract like it should be. And in the systolic here, it can't pump because the chambers here in the left atrium and ventricle are getting overstretched, and it's not being able to pump enough blood into the circulation. This is just another diagram here. This is a healthy heart. This is one with heart failure. As you can see here, again, this left ventricle area is overstretching. This affects it because it's trying to pump blood out through the aorta, which pumps to the rest of the body. And when it's becoming overstretched here, the blood is just filling and pooling, and it's not being able to push through the whole circulation. Backs up, it causes congestion, which is heart failure. If you'd like to watch this video, this is a quick, excuse me 1 minute. This is a quick demonstration of what a healthy and not healthy heart looks like. So this is a healthy one, and you can see it's having synchronous contractility. Then it goes on to the heart failure, and you can see nothing is working together. So this is disynchronous contractions, and this is where the heart just isn't pumping properly, which is heart failure. So back to this. So now we're going to talk about some risk factors. So the top 3 risk factors are coronary artery disease, your high blood pressure, and your diabetes. So the coronary heart disease, the arteries are narrowing. So that's causing some type of heart damage because there's not enough blood getting through to the heart, which can cause damage and result in heart failure. Your high blood pressure, if it's increasing pressure in the heart. So if you're having that, then the heart isn't going to be able to work properly either. And then your diabetes kind of goes hand in hand with your obesity, in that those diseases put you at higher risk for having high blood pressure and coronary artery disease, which can lead to the heart failure. Race, African Americans have a much higher incidence of having heart failure. Your other heart conditions, these diseases cause damage to the heart. So if you go into an abnormal heart rhythm, which is an arrhythmia, your cardiomyopathy, your congenital heart defects, which are ones you're born with, heart valve disease, and your previous heart attacks. And then other risk factors, HIV and AIDS, that causes wear to the heart over time with those diseases. Alcohol or illegal drug use puts additional stress on your heart. Thyroid disorders and cancer treatments do the same. And then age, 65 and older, because as you age, your heart muscle becomes less contractile, and it can put you at higher risk for heart failure. So there are different types of heart failure. There is right-sided and left-sided. Both of them combined together are what congestive heart failure is. The right-sided is the inability of the heart to pump into the pulmonary circulation. So you're going to have a lot of your pulmonary symptoms that we're going to discuss later. The left-sided is actually from right-sided is what that is, and it's inability of the left side to pump into the systemic circulation. So they all kind of work together the right side, the right atrium and ventricle, left atrium and ventricle, if they're both not working properly, then you're going to have the heart failure result from that. Systolic and diastolic dysfunction are both related to heart failure. The systolic is inability of the heart to contract. The diastolic is the inability of the heart to relax. And we are going to talk now about signs and symptoms. So the top 3 signs and symptoms that you can see with heart failure is shortness of breath, your dyspnea, which is trouble breathing, and your orthopnea. And that is where you're having difficulty laying flat, so a lot of these patients need to sit upright. Fatigue, tiredness. This is kind of a chronic symptom that you'll see with these patients. They have trouble walking, even short distances. Then swelling in the ankles, legs, abdomen, which is called ascites, and the veins in the neck, which is called jugular vein distension. So those are the really top main signs that you'll see. In addition, these patients may complain to their physician about having chronic wheezing or chronic cough. That's from the pulmonary congestion. They may not know it at the time, but that's the findings we'll have. Nausea or lack of appetite, impaired thinking, and that's kind of a late sign because they're not getting enough oxygen to their brain. And then high heart rate, so the tachycardia, because the heart is trying to compensate. So how do we diagnose heart failure? Family history assessment. If you have a large family history of having heart failure, it puts you more at risk. Physical assessment, which we'll talk about in the next slide, very similar to the signs and symptoms, but we'll see what you can expect with your patient. Lab testing. So just with a simple venous blood test, they can draw what's called a BNP. That is a hormone level that rises when the heart has damage, and it falls back down when the heart damage is stabilized. Your EKG, that is going to show any abnormal heart rhythms. It can show if there's heart damage as well. Your echocardiogram takes a little bit in-depth look at the heart. It can actually show the vessels in the heart, the valves, how big the heart is, and that can help us diagnose heart failure. They can do it at the bedside. And then your chest x-ray is another one that can show the cardiomegaly and that the heart is enlarged from the heart failure, the stretching. So physical assessment, these patients don't typically look well when they're coming in. They often look very anxious. They are sitting upright, so you often don't have to raise them because they're typically sitting over, trying to compensate, get enough air. They look like they're having labored breathing. Their respiratory rate is usually greater than 20. Their oxygen sats on room air are usually below 95%, usually into the low 90s. Hopefully not worse than that, but can be. They can also have abnormal breath sounds when you're listening. So when you listen with your stethoscope, you can hear some rales, bronchi, coarse, wet breath sounds. They might have a blue cyanosis around their lips. They might have blue around their fingertips. Abnormal heartbeats on the monitor. So you might see that they have tachycardia, or you might see some premature ventricular contractions or an abnormal heart rhythm. High blood pressure, and that's related to congestive heart failure. It's a cause of it, so you might see that on the monitor. Hitting edema, so when you're looking at their legs, there is trace, which is like a level 1. There's mild, moderate, and severe, so it goes up to level 4 for the pitting edema. We talked about them being anxious, and then ascites, which is swelling in their abdomen. Treatment goals. So the long-term goals for this is treating it, the underlying conditions. So your hypertension, your coronary artery disease, your diabetes, making sure that the doctors that you're working with are managing those diseases to prevent them. And then reducing the symptoms are your acute care. So making sure that we're not, we're stopping the heart failure from getting worse. We're also trying to improve the lifespan of these adults long term, because the death toll after 5 years increases substantially. So we want to make sure that we're really preventing with these patients and treating as much as possible, as quickly as possible. there is a couple of different treatment options for these patients. The heart healthy ones are the ones that they can do at home and with the treatment care team. It's making sure that they're reducing sodium intake, and that they're exercising, staying active, reducing smoking, monitoring intake and output along with their weights at home, and in the hospital we do that as well. The ongoing care is where they're working with the interdisciplinary team. So they're working with their primary care physicians, they're working with their cardiologists on a regular basis, so that if they're having any signs and symptoms that they're noticing, they're talking with them about it and getting prevention, or at least management before it gets to a hospitalization for it. And then we're going to talk about the medical and surgical procedures. So the surgical procedures are either long-term or last resort. We certainly would want to do medications first and then surgeries, but a patient might be unstable enough to where they might need a pacemaker, and this helps both sides of the heart contract at the same time, which can reduce the heart failure symptoms. An implanted device like a defibrillator that can help if you go into an abnormal heart rhythm, it will help the patient survive. A mechanical heart pump, and it also goes into heart valves. So if the heart valves aren't working properly, they might need them replaced so that the heart failure won't worsen. And then a heart transplant would be a last option if the heart damage is severe enough. This mnemonic is a good one to remember. So your LMNOP. This is your Lasix, which is your diuretic. Lasix blocks the absorption of sodium chloride in water, which will help decrease your urine output, and eventually you'll urinate all that extra fluid buildup off. The morphine, that is your vasodilator, and that's going to help, not only help with the patient's anxiety, but it's going to open up the airways, get more blood flow in, to help with the backup into the pulmonary arteries. Your nitrates, those also open up the arteries. They're a vasodilator, and what the nitrates are going to do is help increase your cardiac output, help that blood flow again, since it's backing up in the heart. Oxygen kind of speaks for itself. The patient's not getting enough oxygenated blood, so they're going to need more oxygen to help with that. And then your positive pressure ventilation. This is your BiPAP, and that helps force air into the airways, especially when these patients are having increased work of breathing. That will help with that. Your positioning, so if the patient isn't already sitting up, we talked about the orthopnea. They need to be sitting upright, legs dangling over the side of the bed. This will help them with their work of breathing. And then P is urinating, so this is going to be caused from the Lasix, which will help get rid of that fluid. These are just some additional medications. We won't go into too much detail about these, but it's your ACE inhibitor. These are all your blood pressure medications, so these aren't commonly used, but we need to help lower the blood pressure, and these will all help with that. Your beta blockers, your digoxin, and your hydralazine. So overall, let's talk about some key points here I'd like you to take home from this. So prevention is key. So make sure you're teaching your patients about managing the CHF symptoms at home, watching out for those, but also preventing these high risk factors: hypertension, diabetes, coronary artery disease. Making sure that you know these manifestations. The top three are shortness of breath, fatigue, and edema. If you notice these symptoms, you're going to go through the other ones and start working to make sure we can decrease these symptoms. And then once it's diagnosed, we want to make sure that we're preventing further heart damage. So we need to start with the interventions. So your LMNOP, those are the big interventions, those are key, and we want to make sure that we help them with those symptoms. And that is it. Any questions for me? Okay. Well, I would like, there's a quick question and answer for you. I'd like to give you this opportunity so you can teach back to me some of those key points we discussed in the presentation. So can anyone name the 3 most common risk factors or causes of heart failure? Yes.
I believe the 3 most common risk factors and causes of heart failure would be diabetes, high blood pressure, and coronary artery disease.
Perfect, yes. And can anyone name the 5 signs and symptoms of a heart failure exacerbation? So what do these patients look like? Yes.
I believe 5 signs and symptoms of heart failure exacerbation would be shortness of breath.
Mm-hmm.
They could be very anxious. They could be cyanotic, which is blue around their lips or their fingernails.
Absolutely.
They could have edema anywhere from a little bit to a whole lot.
Yes.
And they could
Have jugular vein distension. That's another one.
Okay.
Ascites in the abdomen. So yes, good, very good. And can anyone name the most common medical intervention? So what's that mnemonic we taught you guys? Yes.
LMNOP. So we're going to do Lasix,
Mm-hmm.
morphine, nitrates, oxygen, and then we're going to do positive pressure, which would be a BiPAP. We want them to pee as well.
Yes. And positioning.
And
Make sure they're sitting upright. Very good. Well, thank you guys for listening, and we'll see you next time.